Hello and welcome. My name is Janelle Mirzai. This webinar is presented on behalf of the UCSB Healthcare Facilitator Program. In this webinar, we'll be covering the transition to UC retiree health insurance. This webinar is geared towards UCSB faculty, staff, academic employees who are in the process of retiring or considering retiring in the next 5 years. Here's a brief look at the chapters I will be covering in this webinar. This presentation is intended for communication purposes only. It is not a guarantee of benefits. Details about the UC policies and health plans are available on UCNet. Let's talk about the future of retiree health. The University of California is committed to ongoing health benefits for retirees. However, it is not a guarantee benefits. That means plan designs can change and your share of costs may increase year to year. Understanding where you need to go and what you need to do will help you feel better equipped through your retirement process. Please take a minute to review the resources that are available to you. We have checklists, roadmaps, and UCOP webinars, along with my webinars listed here. RASC has developed a Medicare retirement enrollment checklist to help guide retirees and their dependents through the Medicare enrollment process and the transition into UC Medicare plan. The checklist includes direct, easy-to-use links that allow you to quickly access key resources and relevant websites, making the enrollment process easier to navigate. The guide is now available on UCNet and can be accessed using the link or the QR code below. Let's take a look at eligibility. Okay, eligibility for UC retiree health benefits. Here are some basic eligibility requirements when you retire. In order to be eligible for UC retiree health insurance, you must be enrolled or eligible to be enrolled in the UC coverage at retirement. You must elect a monthly retirement income, have 10 or more years of UCRP service credit for medical and dental, elect to continue coverage, or suspend at the time of your retirement. And if you select lump sum cash out, you forfeit eligibility for retiree health benefits. All questions regarding your UCRP service credit or eligibility status should be directed to RASC or by speaking to a retirement counselor. Graduated eligibility. Currently, UC shares monthly costs of medical and dental coverage with eligible retirees up to a maximum UC contribution that varies each year depending on overall costs. Retirees may be eligible to receive from 5% to 100% of UC maximum contribution to premiums. This is known as graduated eligibility. The amount UC will contribute depends on the date you become eligible for benefits and the amount of service credit you have earned at your age at retirement. So please check the Retiree Health Plan Estimator for 2026 on UCNet. And if you have questions about your graduated eligibility, please contact RASC or you can make an appointment with a retirement counselor. Let's take a look at frequently asked questions. If you separate in June with a retirement of a July 1 retirement date, UCSB coverage will end on July 31st, and UC retiree health and Medicare will start on August 1st. What happens to my family when I enroll in Medicare? So for non-Medicare retiree or family members, they will remain in their current medical plan. And for Medicare eligible retiree and family members, you will all enroll into a UC Medicare plan. When may I change my plan? So starting this year, retirement is now considered a period of eligibility, and you can change your medical plan when you retire. Additionally, you will have the opportunity to make changes during open enrollment, which takes place typically in the fall, or if you move outside of your service area. If you suspend, when can I re-enroll? So if you suspend retiree health insurance, you can do that if you have other coverage, and you can re-enroll during open enrollment or if you have an involuntary loss of coverage. Do dental and vision continue? Delta Dental continues with UC contribution for our retiree vision VSP plan. It is voluntary and you pay premiums directly to VSP. Okay, next is what is the CMS L56 form? For UC employees or their spouses who are 65 and older and retiring, you will be given a special enrollment period at the time of retirement to enroll in the Medicare Part B with Social Security without a penalty. To be eligible for the special enrollment period, you must have demonstrated that you had group health plan coverage through your employer or your spouse's current employer. So the HR department or benefit office at locations can assist with the completion of the employer section B of the CMS L56 form. Myself or the front desk HR assistant can help with filling out this form. As soon as you have the form, you and any family member over age 65 must individually complete a copy of the CMS L56 form and provide it to Social Security office in order to enroll in Medicare Part B. Let's take a look at the non-Medicare plan options. So what if I'm not Medicare eligible yet? So if you're not Medicare eligible when you retire, you will remain in your current plan. If you're a retiree and covered by a UC medical plan, UC will send you a Medicare information packet with enrollment instructions 3 months before your 65th birthday. So please check the UC Net to review your retiree 2026 monthly costs. One of the most common questions received at retirement is, what are my medical plan options? Let's start with the non-Medicare retirees and their family members. If you reside in California or a California service area, you will remain enrolled in the current employee plan, which are UC Blue and Gold, Kaiser, UC Care, and the Health Savings Plan. The UC Care PPO and the Health Savings Plus plan are the plan options for our non-Medicare retirees and their family members who move or plan to move outside of California but remain in the US. Whereas if you're planning on moving overseas, then UC Care PPO and the Health Savings Plus plan will be your option. For our Medicare plan option, here is a quick overview, which I will discuss in more detail later. Delta Dental PPO and Delta Care USA coverage remains the same. So the premium is paid in full by UC, or you're subject to graduated eligibility. So please check the retiree premium estimator to view your costs. Delta Dental PPO provides worldwide coverage, and then Delta Care USA HMO is for California enrollees only. So the VSP plan is optional. You pay full premium to VSP. As some of you may know, our Medicare plans do provide yearly optometry vision screening, but not glasses or contacts. So if you need contact or glasses, I suggest enrolling into VSP. Okay, next, what happens to your flexible spending account and health savings account at retirement? If you retire after leaving your job, your health FSA coverage ends on the last day of the month following the month in which your separation occurs. So for example, if you separate on June 30th and retire on July 1, your coverage ends on July 31st. If you separate on March 1st and retire on March 2nd, your coverage ends on April 30th. You may submit claims for eligible expenses incurred through the last day of participating in the plan. Expenses incurred after this date aren't reimbursable. So it's a use it or lose it funds. And for the health savings account, you own your HSA. This means HSA funds automatically roll over every year and the account becomes part of your estate upon death, or the account can transfer to your spouse as an HSA. So HSAs provide flexibility in it. You can use the funds before and after you retire. Okay, Medicare plans options. So I'm going to go into more detail about Medicare and our Medicare plans options at retirement. So each of our UC medical plans has a Medicare version. You can see on the left-hand side that non-Medicare plans, which are UC Blue and Gold, Kaiser, UC Care, and Health Savings Plus plan. Each of these plans have a partner plan. When you retire and become Medicare eligible, you would transition into the UC Medicare plan. That means if you're currently in the UC Blue and Gold HMO plan, you will automatically transition to the UC Medicare Choice plan. And for the Kaiser HMO plans, you will transition into the Kaiser Senior Advantage plan. And for the Blue Shield PPO plans, you will automatically transition into the UC Medicare plan. Okay, types of medical plans. When a family has split non-Medicare and Medicare members. So when a family has both Medicare and non-Medicare members, then the non-Medicare eligible members will remain in the current non-Medicare plan, whereas the Medicare eligible family members will transition into the Medicare plans. So if you have some family members who are not 65, they will therefore remain in the UC Blue and Gold HMO plan, while your Medicare eligible family members will transition into the UC Medicare Choice plan. This is what we refer to as split families. As a side note, the Health Savings Plus plan is not available to split families. So if you're enrolled in the Health Savings Plus plan and you have a family member who is becoming Medicare eligible, then you would transition into the UC Care and the Medicare PPO option. Are you moving or thinking about moving after you retire? For the UC Medicare Choice, Kaiser, and High Option plans, you must live in California or California service area. If you move outside of California but remain in the US, then UC Care and Health Savings Plus plan would be your options. The Health Savings Plus plan also is available for retirees that are not Medicare eligible. The UC Medicare PPO plan and UC Care plan are only available for split families. This means that when some family members are eligible for Medicare and some aren't. If all your family members are eligible for Medicare and you live outside of California, then you and your family would elect a plan through the UC Medicare Coordinator Program administered by VIA Benefits, and we will take a closer look at this in the next slide. As mentioned in the previous slide, if you're living outside of California but in the US and all family members are eligible for Medicare, then you and your family will be moved to the UC Coordinator Program administered by VIA Benefits. For retirees eligible for the maximum UC contribution toward retiree health insurance, you will receive a $4,000 contribution toward a health reimbursement account for each member. This contribution is subject to graduated eligibility. This means if you're not eligible for the max contribution, you will receive a percentage of the $4,000 contribution. You then use the funds to purchase an individual Medicare health plan and Part D through VIA Benefits. Any unused HRA funds roll over to the next year. What if I'm thinking about moving outside of the United States? What is available to me if I move outside of the US? As many as you know, Medicare is a federal program, therefore you do not have international coverage through Medicare. If you plan on permanently moving outside of the US, your plan options at retirement would be UC Care PPO and the Health Savings Plus plan. Both of these plans offer international coverage. Now let's take a closer look at how UC retiree health insurance premiums are calculated. Each year, UC determines the maximum contribution paid towards retiree medical and dental premiums. Maximum contribution does not mean that UC pays retiree health insurance in full, but the retirees are eligible for the maximum amount UC pays towards retiree health insurance. That said, some retirees are eligible for the maximum UC contribution and others may have graduated eligibility, which means they receive a percent of the UC contribution amount. Where do I find my rates? So if you're eligible for the maximum UC contribution, you can find these rates on UCNet under the Retiree Medical Plan Cost 2026. The maximum contribution rate is listed on UCNet and is broken into 4 categories. You want to research the category that you and your family belong to determine your premium. For folks with graduated eligibility, RAS will calculate your premium based on your age, years of service credit. You'll find additional information in the Retiree Handbook, your UC Rates account, or by checking the Retiree Premium Estimator located on UCNet. Okay, next we're going to take a closer look into Medicare and how Medicare and UC Medicare plans work together. Medicare is a federal program that provides medical insurance for people 65 or older, people with disabilities or specific medical conditions. Medicare covers most medical services but does not pay total cost of care and services as the foundation for all UC Medicare plans. The University of California requires all retirees and family members to enroll in Medicare if eligible. Coordinating your UC medical plan with Medicare helps sustain the retiree health program. An exception, if you live outside of the US, you are not required to enroll into Medicare. Who is eligible for Medicare? I always encourage folks to contact the Social Security office if you have any questions about eligibility or how to enroll. When does Medicare start? Typically, it starts the first day of the month in which you turn 65 for most. Okay, applying for Medicare is easy, I promise. You apply for Medicare Part A and B, or Part B if you're already enrolled in Part A. Complete the appropriate UBIN form, which is the enrollment form to transition you from the non-Medicare plan to the UC Medicare plan. And lastly, inform and give your doctor your Medicare card and the UC Medicare ID card at your next visit. Let's take a look at the different parts of Medicare. Part A. Part A provides partial coverage for hospital stays, skilled nursing, and hospice. Part B provides partial coverage for office visits, labs, and medical equipment, and Part D covers prescription drugs. Now, I'm sure you noticed I skipped Part C. Part C is the name used for Medicare Advantage plans. Under a Medicare Advantage plan, you assign your Medicare over to a private insurance provider, and they manage your healthcare needs on behalf of Medicare. Part C, so we have two Part C plans, which include UC Medicare Choice and Kaiser Senior Advantage Plan. Medicare Advantage plans generally combine coverage for Part A, Part B, and Part D. 2026 Medicare costs. So Medicare reviews your modified adjusted gross income reported on your IRS tax return from 2 years prior to determine your Medicare premium. So this year, Medicare will be reviewing your 2024 tax return to determine your 2026 Medicare premium. There is no monthly premium for enrollment in Part A for most. The Part B premium for 2026 for most will be $202.90. If you made more than $109,000 as a single person or greater than $218,000 jointly, you'll pay the standard premium amount and an income-related monthly adjustment amount known as IRMAA, which is an extra charge added to your Part B and Part D premiums. Medicare and UC premium breakdown. You will have separate Medicare and UC premiums. Your Medicare Part B, and if you have higher income Part D premiums, will be directed directly from your Social Security check. If you are not yet receiving your Social Security benefit, then your Medicare premiums will be billed to you directly in 3-month increments, whereas your UC medical and dental premiums will be deducted monthly from your UC pension check. Since vision is optional, you will pay your premiums directly to VSP. Now let's explore the cost of medical care. Medicare and your UC plan pay for most of your medical expenses. They work together. Each of the plans may have different benefit costs, medical providers, service area, behavioral health providers, enrollment and de-enrollment processes. Please take the time and review your plan carefully. Okay, so as previously mentioned, UC offers 2 Medicare Advantage plans, United Healthcare and Kaiser Senior Advantage. So with United Healthcare will be your primary and Medicare will be your secondary. You assign your Medicare to the insurance plan, provider bills insurance directly, and referrals are not required. And for the Kaiser Senior Advantage HMO plan, you assign your Medicare to the insurance plan, provider bills insurance directly, cannot use Medicare outside of the plan, and PCP referrals are still required. Choice of physician. Okay, so for our UC Medicare choice is a PPO Advantage, and the plan is administered by United Healthcare. You do not need to assign your PCP, so it's not like the traditional HMO plan where your PCP is the one that's going to write referrals for your specialist. With this plan, that's not required. You do not need to see referral specialist and may use United Healthcare doctors or Medicare doctors who accept Medicare assignment and willing to bill United Healthcare. And a reminder, United Healthcare will be your primary and Medicare is your secondary. So when you go to the doctor's office, you provide them your United Healthcare card and say, this is my primary and Medicare is my secondary. Under the Kaiser Senior Advantage plan, you must select a primary care physician. The PCP will coordinate your care. PCP refers to specialists, and the specialist is limited to the medical group. Under the UC Medicare Choice and Kaiser Senior Advantage plans, you pay copays for your care, and you do not have a deductible. That way you know exactly what you're going to pay for each service, and there's no surprises. In addition to the UC Medicare Choice and Kaiser Senior Advantage plans, UC offers 3 supplement to Medicare plans, UC Medicare PPO, UC Medicare PPO without pharmacy, and UC High Option plan. Now, the UC Medicare PPO without pharmacy is the exact same plan design as the UC Medicare PPO plan, with the exception that it does not include pharmacy coverage. Since these plans are supplements to Medicare, Medicare is the primary insurance, and the UC Medicare PPO High Option plans are secondary. Under these plans, you have an annual deductible and you pay co-insurance. So with this plan, Medicare is your primary, Anthem will be your secondary. So when you go to your doctor's office, you give them your Medicare ID card and say Medicare is my primary. And again, under the Medicare supplemental plans, Medicare is the primary and Anthem is the secondary. Therefore, whenever you need to see a new doctor, you must visit Medicare providers for Medicare services. You can visit Anthem or non-Anthem providers for additional services. So for example, hearing aids is not covered by Medicare, but it is covered by Anthem. And acupuncture services. You would not go on the Medicare website to look for an acupuncturist in your area. You would go onto the Anthem website and look up in-network acupuncturists in your area. So these are, for example, the only one of the two services that is not covered by Medicare, but it's covered by Anthem. Let's take a look at this hospital example. So in this example, the Medicare Part A deductible is $1,736, and that pays the full Part A deductible for both Medicare PPO and the high option plan. In this example, the first 20 days of skilled nursing is paid in full by Medicare. Then from the 21st to the 100th day, the rate is $217. For days 21 through 100, Anthem pays 80% under the UC Medicare PPO plan, and under the high option plan, it's covered 100%. When traveling outside of the U.S. If you're traveling outside of the U.S., there are some things to keep in mind depending on which plan you're enrolled in. If you're in the Kaiser Senior Advantage plan, you will be covered for ER and urgent care services only. For the UC Medicare Choice Plan, you'll be covered for emergency, urgent care, and routine services, and you will have a copay. For the UC Medicare PPO plan, there's a $100 annual deductible, and you'll be billed 20% of the billed amount. And for the UC High Option plan, it's going to be a $50 deductible and a 20% of the billed amount. Behavioral health. Each of the UC retiree health insurance plans offer mental health care and substance abuse treatment. Coverage and provider networks do differ. Behavioral health coverage and providers for the non-Medicare plans are the same as the UC employee plans, whereas the behavioral health provider changes once you transition into the UC Medicare plan. Now let's take a look at prescription drugs coverage under the UC plans. Okay, for Medicare Part D, you pay copays for prescriptions and some formulary list depending on what plan you're in. For ID cards, the UC Medicare Choice and Kaiser members, there will be one ID card for both medical and pharmacy on the same card. And for our Anthem PPO members, you will have two cards, one for medical and one card from Navitus, which will be for your pharmacy. All of the UC Medicare prescription drug plans have drug maximums. So each of the plans have a bundled prescription drug plan with the exception of the UC Medicare PPO plan without pharmacy. Each of these plans have a prescription maximum. That means once you hit the maximum in the plan year, the plan will pay 100% of the cost for the rest of the year. So if you're interested in the UC Medicare PPO plan without prescription drugs coverage, this plan might be a good fit for retirees with graduated eligibility who may want to consider this plan to help reduce the out-of-pocket costs, or if you have less than a number of years of UCRP service credit. Please keep in mind, Medicare allows only one Part D drug plan. You can enroll in the UC Medicare PPO plan without pharmacy, but you must enroll in a non-UC Part D drug plan. You then need to provide proof of this coverage to UC in order to avoid penalties. When you enroll in Medicare, it will depend on whether you are still an active working employee, retiring and turning 65, or you're retired and turning 65. Current employees, you may enroll in Part A when first eligible at age 65, but it's not required. If you enroll in Part A, do not enroll in Medicare Part B or D. Spouse enrolled in your UC employee medical plan does not need to enroll, and you will have a special enrollment period at retirement. Here are some special considerations. For the Health Savings Plus plan, delay enrollment in Medicare A, B, and D until retirement. Please note, if you are drawing a Social Security pension, you are automatically will be enrolled in Part A at age 65. You cannot contribute to HSA. For domestic partners at age 65, consult with Social Security about when to apply for Medicare. You may or may not have a special enrollment period while enrolled in an employee plan. So I highly suggest reaching out to the Social Security office. New Medicare enrollment. This is an update from RASC and the Social Security office. Due to the government shutdown or the previous one, staffing limitations and capacity constraints, they are no longer able to process enrollments 90 days in advance. Moving forward, they will process enrollments beginning 60 days prior to the Medicare effective date. Please note that the 90-day timeframe is still reflected in the existing educational materials. 60 days prior applies for in-person paper form, which will be your Medicare Part B in the CMS L56 form. To save yourself a trip to be turned away, I am advising submitting the form 60 days prior. However, for our online enrollments, you can continue the 90 days prior. If it's too soon, the system will give you a message. Locally, I have not heard about any employees or retirees being turned away. Eligible at retirement. Apply for Medicare Part A and B 2 months before you retire. Enroll online or call Social Security office 2 months before UC employee retires. RASC will send you the UB Medicare enrollment form. RASC and the Social Security office will advise you on the CMS L56 form, and you will then submit this CMS L56 form to the Social Security office. They will need the CMS form in order to process your Part B application. If you become eligible for Medicare after retirement, then you will want to apply for Medicare Part A and B about 3 months before your 65th birthday. You can apply for Part A and B online on the Social Security website, or you can go to your local Social Security office to apply. UC Medicare forms. These are the name of the forms that you will need to transition from a non-Medicare plan to a Medicare plan. For example, if you turn 65 or in the UC Blue and Gold plan, you will transition into the Medicare Choice plan. You will complete and submit the UBIN 121 form to the retirement center. Once you complete your forms, you will need to submit them through either UC Raise or by fax or mail. Please do not submit your forms online and by mail or fax. It will cause delays and additional work for RASC. Please only choose one option of form submission. If you have any questions, you can reach out to me directly. I'm happy to help you. Let's review the timeline of events that will occur for those individuals transitioning to Medicare during or after retirement. So first you apply for Medicare A and B on the Social Security website. Social Security office confirms enrollment. You send your UC form to RASC. RASC and insurance update your plan. Insurance enrolls you in Part D. Insurance sends you your new ID cards, and you inform providers of your new plan. Fidelity. Andrew Fung, a dedicated Fidelity Workplace Financial Consultant for UCSB. He can help you with understanding your retirement saving program, evaluating your individual situation and priorities, rollovers into UC retirement saving program, comprehensive retirement income planning, legacy planning, and charitable giving and tax strategies. So if you have any questions about that, please reach out to Andrew Fung. If you aren't interested in coming back to work, but you're interested in staying connected to the campus, I strongly encourage you to visit the Emeriti Retiree Association. Ellen Pasternak is our Emeriti and Retiree Coordinator, and she sends out monthly newsletters and details of upcoming local events. If you're interested in becoming a member or would like to attend her email list, please directly contact her. And her email information is listed. Do you have questions? If you have questions, I will still be your healthcare facilitator in retirement. You can reach out to me by calling me, or you can email me, and my contact information is listed on this slide. Now that concludes the part of my presentation. Thank you so much for attending.